I've got kids, and that means it's always about them. But I need support too. That's where Ollie comes in. With their delightful, hardworking gummies, my partner and I can actually get a good night's sleep, so we'll both stand a chance of managing our stress responses. Even when the kids are doing parkour in the living room, discover Ollie vitamins and supplements. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Anthony Porto. Hello, Anthony.
Hi, Jess. How are you doing?
Good. So today we are going to talk about reflux. The clock is ticking, so let's get to it. Anthony, what is reflux? I see here, so gastroesophageal reflux. Do you call that, is it GER, GER? I don't even know what you call it.
It's a great question. So really, reflux, basically is when acid is in your baby's stomach and it comes back into the esophagus. And we commonly think of this as adults as GERD, right? We hear about that. But in kids, it's not a disease. So that's why the D is missing. And it's quite common in infants, and it's often referred to as a happy spitter. So typically it starts at around 2 to 3 weeks of life. It peaks at 4 to 5 months of life, and then it begins to improve. And it occurs because kids are still developing even after they're born. And that lower muscle, or that lower esophageal sphincter that separates the esophagus from the stomach, is short in infants, and it will relax whenever it feels like it. And since infants are feeding so regularly, the relaxation makes it easier for the formula or breast milk to come back up.
That's so interesting. My daughter, Sophia, had terrible reflux for the first year of her life. How can we help manage reflux in our baby?
There are a few things that you can do to manage reflux. First, keeping your baby upright for about 20 to 30 minutes after they're feeding. Trying not to overfeed, so listen to your child's hunger cues and know when they're full. And then you can burp at natural pauses within the feed, so usually at every 1 or 2 ounces. Some kids may get congestion from the reflux, so you may want to use some nasal saline drops. This can help decrease the congestion, help them sleep better, and also maybe make the feeding a little bit better as well.
But at what point should we be concerned about our baby's spit up?
Well, I think, as you said about your daughter, my daughter as well had really bad reflux as well. So it's natural to be concerned about frequent spit ups. But for most infants, it's really just an issue of a lot of laundry and being prepared when you're traveling to make sure you have an extra set of clothes. But if your child is experiencing feeding problems, and this could be crying or arching during feeds, moving their head away during a feed, not latching well, if they're vomiting excessively, or if they're not gaining weight like they should, it might be more than typical spit up. And that's when you need to speak to a doctor about it, who may recommend blood work or special x-rays to help examine your child's anatomy and understand what may be going on.
So at what point should we consider medications?
So while most infants won't need medications at all, some may need it. And it's really especially if you have one of those red flag signs. So they're having pain with feeds, they're not growing well. These medications can either neutralize acid, decrease how much acid is made in your child's belly, or block acid from being released. But these medicines can come with risks, so you really only want to use them when necessary.
Got it. We actually did have to use medications for my daughter. And it's so funny, the thing that you said about laundry really resonates because we literally smelled like spoiled milk for the first year of my daughter's life. All right. So when can we expect reflux to resolve?
So it's usually short-lived, although we might not think about it. So most kids will outgrow this by the end of infancy. With my daughter, we saw the vomiting really decrease often during that time, but she still did have occasional vomiting during that 12 to 18 months of life. But the majority will resolve by the end of the first year. Again, worrying is natural, but it's really important to make sure that if your child's a happy spitter and growing well, it really is a problem that will resolve over time. And remember, every child is different. So if you are concerned, really speak to your pediatrician to make sure that you're doing everything you can to ensure your child's growth.
All right. Well, I learned a lot. We hope you learned a lot, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.